Foam in urine. Should you be worried? The human body is capable of sending various signals that warn that something is not working as it should. Changes in the appearance of urine, its quantity and the nature of urination should alert you and serve as a reason for a visit to the urologist. In particular, it is useful to pay attention to foamy urine, as this can be a warning sign of various diseases. If you notice a change in the appearance of urine or urination, you should be observant. If everything returns to normal within a few days, then there is nothing to worry about. However, if this does not happen, it is better to conduct a laboratory test. What are the reasons? Normal urine is straw yellow in color, transparent, without traces of blood or foam. It may contain clear bubbles, which should not be confused with foam. One of the possible reasons for the appearance of foam in the urine is poor hydration of the body. In fact, when a state of dehydration occurs, temporary proteinuria, an increase in protein levels in the urine, occurs. In such cases, it is important to drink more to rehydrate and reduce protein levels in the urine. Ideally, you should drink at least 8 glasses of liquid throughout the day. If it is very hot or you are engaged in physical activity, it is better to increase the amount of fluid you consume. Foamy urine is often observed due to certain urinary habits, in particular from flowing too quickly. In fact, if urine is forced into the toilet water, it can create foam. What to do? In fact, if the flow is naturally powerful, then there is nothing to worry about. However, if this is the result of forceful pressure applied during urination, then it is better to try to reduce it. Sometimes foamy urine is associated not with temporary, but with permanent proteinuria. Under normal conditions, most proteins are filtered by the kidneys and reabsorbed into the bloodstream. However, if there are problems with the genitourinary system, proteins end up in the urine in excessive quantities. Often it all depends on diseases, such as kidney disease, diabetes, high blood pressure, autoimmune diseases. Protein in urine can also be associated with physical injury, pregnancy, obesity, age over 65, and certain medications. The presence of foam and bubbles in the urine is associated with a fistula between the intestines and the bladder, i.e., with abnormal communication of these organs, which normally do not have points of communication. In fact, under these conditions, gas can enter the urinary tract and create foam and bubbles during urination. In turn, fistulas can be caused by a number of health problems, such as diverticula, bladder tumors, colon tumors. It is very important to monitor the symptoms that accompany foam in the urine, which should be reported to the doctor: abnormal color, odor, lack of appetite, nausea, back pain, general fatigue, swelling of the extremities, blood in the urine. Foamy urine in men can be the result of retrograde ejaculation, a problem in which semen, instead of being ejaculated through the urethra, flows back into the bladder, mixing with the urine and making it cloudy and foamy. This is usually especially noticeable during the first 1 or 2 urinations after sexual activity. In most cases, this is a temporary problem. However, if foamy urine persists after sexual intercourse, it is wise to consult a doctor, as this may be a sign of a more serious problem. Treatment: if urine foams when men urinate, treatment methods may vary. During the diagnosis, the specialist will identify the cause of the formation of foam in the urine, and depending on this, he will determine treatment methods. In some cases, medication and physiotherapeutic treatment is sufficient. Sometimes surgery is necessary. If there are any changes in urine, Consult a doctor. This will help prevent serious pathological conditions and get rid of dangerous diseases at an early stage.